medications for substance use disorders. So these are also a very heterogeneous group of meds. I put them all in basically one section. So we have medications for opioid use disorder like methadone or buprenorphine, clonidine, lofexidine, and naloxone. There are those that are used for opioid or alcohol use disorder in both of them, like naltrexone. The medications that are used for alcohol use disorder specifically are acomprozole and like Camprol and disulfiram, which is very rarely used these days. And finally, we have varenicline for nicotine use disorder. So as expected, their mechanism of action is very diverse. Those that are used in opioid use disorder mainly work on opioid receptors. So methadone and buprenorphine on the top, they are opioid receptor agonists. They activate opioid receptors. And that's why they're used to replace the illicit drug. They basically, their purpose is to replace the illicit drug use and help decrease the withdrawal symptoms and decrease the craving. We have lofexidine and clonidine. These meds are supposed to help with withdrawal symptoms when someone is going through detoxification or abstinence, right? And they work through norepinephrine pathways. We have naloxone, which is a blocker of opioid receptors, and that's why it is used in opioid overdose. So you may have seen in movies or in real life, and when they find someone that has overdosed on opioids, they administer naloxone to reverse that. It works in a matter of seconds. It's a very potent medication. We have naltrexone, which is also a opioid antagonist. And it is helpful for maintaining abstinence from opioids when someone has already gone through detoxification. And interesting enough, this medication can also decrease craving and relapse in both alcohol use disorder and opioid use disorder. So this medication frequently gets prescribed in those with alcohol drinking problems. Acomprozole is a medication that works through glutamate pathways. It helps with maintaining abstinence. Disulfiram is the punishment medication that is very rarely gets prescribed or used anymore these days. Its function is basically to make someone have a terrible experience if they drink alcohol. So their ethical and moral considerations around this medication is not used that much anymore. And varenicline is a nicotine receptor activator, basically, and that's why it can decrease the craving for nicotine or smoking, basically. So it can replace nicotine use. And consideration. So the efficacy of these medications is a matter of days, seconds to hours to days, depending on the symptom domain. So when it comes to physiological withdrawal, they help with the physiological withdrawal very quickly, and with the craving in a matter of also hours. But decreasing the reward from illicit substance use usually happens over time. In terms of side effects, again, usually immediately, 2 hours, very shortly after the medication. There can be nausea, headache, liver toxicity, diarrhea, constipation, insomnia or drowsiness, sedation, and respiratory suppression, especially with the opioids, and hypotension. Workup, usually vital signs and LFTs should be enough. And LFT is the basically liver function test.